Hello, my name is Dr. Gill. I've been asked to do an examination of your spine today. Before we start, could we please confirm your name and date of birth?
Yes, it's Ross Cooper, 2nd of August 1994.
Super. So in terms of doing the examination, it's going to involve you taking off your shirt. We're going to have a look at your spine, and then we're also going to get you to lie on the bed and do some movements, and I'll press down your spine. Are you happy to proceed with that?
Yes.
Super. So if I can get you to take your shirt off, please. Okay. And if you could just walk 5 paces, turn, come back, and stand here afterwards. So as observing the gait, there's no signs of a foot drop, and there's not any evidence of an antalgic gait either. We don't seem to have any obvious issues there. And if you just turn to face out for me. Okay, so having a look from the front, I can see your shoulders seem equal, don't seem to have any issues with muscle imbalances. And then having a look from the side, I can see we've got a normal cervical lordosis, we've got a good thoracic kyphosis, and a normal lumbar lordosis with no abnormalities there. So if you turn to face the wall for me. Okay, and again, having a look at the back here, I can't see any issues with scoliosis, there's no scars, there's no obvious muscle imbalances. So what we're going to do, I'm now going to press across your spine, see if I can see any areas of pain or tenderness. So if I get you to turn to face away from me. So I'm just going to start off at the top of the spine, so just going to press over the spinous processes. So tell me if there's any pain here. And then pressing over the sacroiliac joints. Any pain or tenderness there?
No.
And then I'm going to press over the facet joints. So tell me if there's any pain at all. No pain or tenderness there?
No.
Okay, I'm just going to press over the muscles of the spine, by the spine, the paraspinal muscles. Tell me if there's any pain. No pain or tenderness there?
No.
Okay. Okay, no pain there?
No.
Super. So I couldn't see any obvious issues with that. So what we're going to do now is we're going to have a look at the movements to the spine. So if you could turn around to face me, please. So we're going to start off with your neck. So if you could put your chin on your chest, please. And then all the way back. And back to centre. And if you could look all the way one way. And then all the way the other. And back to centre. That's good. Any problems with that?
No.
Okay, we're going to make it a little bit more difficult. You can put an ear to one side. And then the other. Super. And any discomfort there?
No.
Super. We're going to have a look at moving in terms of the thoracic spine in a moment. But if I can get you to try and reach to one knee for me. Great. And up. And to the opposite side. That's good. And if I can get you to turn to face forwards for me. And I'm just going to put my fingers at the base of your back. And if you could bend forward to touch your toes, please. And then come back, please. So we've got an excellent range of movement there. I'm going to double down on that now. I'm just going to take the tape measure. So we can see the marks of the posterior superior iliac spine. So I'm measuring 15 centimetres in total, so 10 centimetres up and 5 centimetres down. So if you could bend forwards for me, please. Okay, and then come backwards, please. Super, so we've got an excellent range of movement there. We've nicely gone from 15 centimetres to 23 centimetres of movement, so clearly no reduction in the lumbar spine. If you'd be kind enough to sit on the bed for me, facing me. And if you put your arms over your chest, please, and turn all the way to the left, and then all the way to the right. Any problems with that?
No.
Good, and your elbows on both sides moved across the midline, so we can see you've got a good range of movement. Make it to lie back on the bed for me. Do you have any problems with your hips at the moment?
No.
So now we're just going to see if there's any problems with the nerves. So we're going to do a sciatic stretch test. So I'm going to lift this leg up as high as I can. Any problems in your back with that?
No.
And any pain on the back of the leg?
No.
Okay, so I'm just going to move the foot. Does that change things at all?
No.
Super, and we'll come back down. And we'll do the same on this side. So lifting all the way up. Any problems at the back?
No.
And any problems at the back of the leg?
No.
Okay, so I'm just going to move the foot. Any problems with that?
No.
Super, thank you. So at this point we're now going to check for any problems with the nerves. So I'm going to quickly check the reflexes on the foot. So just getting the tendon hammer. And we're going to look at the reflexes starting off at the feet. Okay, good, nothing there. And we're just going to move the leg outwards, bring the ankle up, and 1, 2, good. So we've got a good reflex at one ankle, coming around the other way, moving the ankle up, 1, 2, 3. If I get you to sit up and swing your legs down for me, just going to check the reflexes to your knees. That's better. Okay. And then we're going to look over the reflexes to your upper limbs. So I'm going to do the triceps. I'm going to pick up your arm like so. Stay loose and floppy for me, loose and floppy. 1, 2, 3. Okay. I can feel the movement of the muscle. Okay, super. And relax down for me. And we'll do the same on the opposite side. Up. And loose and floppy, loose and floppy. There we go. Super. And relax for me. Now we're going to have a look at your biceps. So bringing the arm around. 1, 2, 3. Okay, so I can feel a nice contraction there of the bicep. And again, 1, 2, 3. Excellent. So if you could relax your hands on your sides for me, just going to check the supinator reflex. Okay, good. And on this side, 1, 2, 3. Excellent. And we're just going to do the finger jerk. 1, 2, 3. Okay, excellent. And again on this side. 1, 2, 3. Super. So we've got a normal spine leg assessment and we've got a normal neurological exam. If we needed to, if you've got any problems on the front of the legs, then we could also check a femoral stretch, but we don't need to do that at the moment. Do you have any questions for myself at the moment?
No.
Super. Well, thank you very much for your time.